It's so great to see so many names here in the chat. So great to see you and have you join us today. Oh, lots of people coming in. This is awesome. So we are about to jump into our annual live update for International SCN8A Awareness Day that is really focused on talking about the state of SCN8A. We want to share with the community what's been going on, what we're excited about. We have a lot of exciting guests coming to chat with us today to talk about what's new in SCN8A, where things are headed, where we've been. So I think it's going to be a great session, and yeah, I'm really looking forward to spending the afternoon or evening with you or midday with you wherever you are in the world, because we know we've got people from all over the world here with us. So just to start, level set, we are here celebrating International SCN8 Awareness Day. These are just a few of the frames out there. I was going to try to get some more from all the other. There's so many beautiful frames that TCSF made and that SCN8A Spain made, and I think Brazil. So there's a lot of beautiful things being shared out there to spread awareness about SCN8A and what this life is living with someone with SCN8A. So um, I think before we jump into everything, we always like to start by just honoring Shay. Today it actually would have been Shay's birthday. Well, it is Shay's birthday.
Yeah.
And the community purposely chose this day to mark International SCN8 Awareness Day because we always wanted to remember Shay and everything that she has really contributed to this community through her father. We know that Michael, you really say that Shay works through you, right? And so, how old would she have been today?
30.
30. I thought
Mm.
today was a big one. So,
Yeah. Yeah.
oh, that's
I know.
I have to try not to
It's
cry because every time I think about it,
yeah.
yeah,
It's challenging to but inspiring too. So,
yeah, yeah. I mean, she's so beautiful. I remember, was it last Awareness Day or two Awareness Days ago? One of her old teachers sent you new pictures you'd never seen of Shay.
yeah.
I always think about that, and it's just like so powerful to see new images of her after she's been gone for
Yeah.
so long. But
Yeah.
yeah. And I think there's so much amazing work, even still going on with her her genetic data that was left behind, the mouse model and iPSC lines, and there's so much work happening that keeps Shay with us. So I think that's pretty powerful. So I know she's always with you, and we see her and hear her legacy as this work continues. So
Well, thank you. Thank you. I mean, it's an honor to have Shay be the poster child, if you will, for this Awareness Day. It warms my heart every February 9th on a day when it could otherwise be very devastating and hard to have everyone supporting in the community and honoring Shay with this day. So thank you all for that.
yeah. And I think it's also, we want to just pause too and remember that there's so many children that we have lost with SCN8A. It has been, I think we started really collecting names and data about children who had passed 10 years ago or so. And so, um, unfortunately, this list continues to grow, but every single one of these kids contributed to our understanding of SCN8A, to helping us better learn about how we better treat and care for people with SCN8A and advocate for them. So, we wanted to just mark that. And I hope this is everybody. There's names that we may have missed, but if we did, please let us know. But, every single one of these kids mattered, left a mark on us and the work that we do, and we continue to fight for better answers in their memory, in their honor. So we always like to open just thinking about that and talking about that because there's so many kids that we are still fighting for who are with us today, but there's so many who we've lost along the way and we haven't been able to help, but they've been a part of the journey to get us closer to better answers. So Yeah, so we always open our session kind of with these are the three co-founders, Jayetta, who is my mother and our co-founder and the board chair, and Michael Hammer needs no introduction, I think. We discovered the gene that causes epilepsy in SCN8A, and now we know so much more that these genetic mutations do so much more than just cause seizures and epilepsy. So, we're just going to chat for a couple of minutes about, what has been most meaningful in the last year and what we're excited about seeing as things move forward. So, Jayetta, why don't I start with you as board chair? What have you seen?
Well, I think we've made really continued progress in our commitment to collaborating across the entire community. It was a very powerful step at AES this year when we joined Hillary and Casey at the stage, talking about our commitment to collaborate and work more closely together. And many initiatives are moving forward from that renewed commitment that we'll talk about today, and similarly advancing our commitment to collaborating with all the global partners. And again, we'll have some announcements about that today. So I think it's not new to this year, but it's the renewed and growing impact to collaborate, because time can't be lost. We have to accelerate, and we do that better by all working together.
Yeah. What about you, Michael? What has been, the last year, so much has happened. Kind of what stands out for you? And I know
Well,
you've got some
I
more
don't,
conversation coming down the line where you're going to expand on this more, but I just big picture. Yeah.
yeah, big picture. Yeah, I agree. I agree with Jada. This has been a year of bringing things together and collaborating. To me, that's the theme of this year for me. And I'll show a slide or two just highlighting what I mean. But I think as far as the work goes on the research side, we know there's been so much progress both on the registry level. We've got over 500 participants now, and so we're able to really learn a lot about the disease and all of its multifarious ways of presenting and getting better treatments. We know there are better treatments on the horizon, both in the laboratory and in the clinical trials, and progress just continues. It's amazing. So I think it's been a very productive year since our last meeting on Awareness Day, in so many levels. It's hard to say it in a soundbite, but it's been an exciting year.
Yeah. And did you want to, I know you had a visual that you talked about that you wanted to share that really highlights this collaboration, because I'll agree that the last year has felt like there's been some real progress in terms of how we're all working together and what we can achieve as we're really looking to do more together.
Yeah, so in the spirit of this collaboration and this work that we're all doing, and I made a couple of images that on the left, you might not be able to read this, but it basically says SCN8A, the letters are hidden in there, and it says us and all. And I really feel like it is us all this year. And we are so blessed to have three foundations in the United States and the global leaders around the world all working together under one umbrella. And I just wanted to highlight that the Shay Hammer Research Foundation, the Acute Syndrome Foundation, and the International SCN8 Alliance all working together in this little trail, just showing you some of the highlights of the science and the building the networks and the family support that we all work toward. And the global leaders across all the countries as well are part of this. And I kind of asked Casey and Gabi just to give me a couple of the, highlights, since we're talking highlights here. And the TCSF, they're most proud of the Connor James Smith program, the assistance grant that they give every year on behalf of the Smiths, sorry. And it really helps a lot of folks out who need help. Their annual SCN8A gathering is a highlight every year. And they really are proud of the work they do to empower families through education and community. The Alliance, and there's so many things that the Alliance does as an umbrella organization, and you're going to hear so much about it today. I just picked out a couple of things that I thought were important, and that is we do have this network of global leaders. We have network meetings with families that bring together families on certain topics that relate to the spectrum of the disease. So, on the milder side with behavioral disorders, or on the more severe side with the DEEs. We have a research network, and we have a clinicians network. So it's really a wonderful organization networking all the stakeholders. And it's just touching on some of the highlights of that foundation. And together, this year you're going to hear a lot about the collaborative grant program that we've worked on together. And it's another highlight for the all together, the all of us together sentiment and powering ourselves to move forward together. And so if there's any confusion out there among families as to what organization does or that organization does, it's all on the web. You can find us, all the details, what everyone does. But I wanted to highlight the fact that we are together working on the same cause to support families and find better treatments. And we're blessed to have all of these organizations together. And I just wanted to thank you again for having Shay be centered on the Awareness Day theme. She's with me, and she's with me every day. And she's like Abby said, she powers my work in the work I do with you all. And you all give me so much support and solace. It's a blessing for me to have you in my life. You're all my family. So thank you very much.
Amazing. Yeah, no, I think this whole community feels very deeply rooted in the origin story of the work that's happening today, which obviously we're all here because of. So, and some love coming in through the chat, Michael, which is very sweet. Yeah, so I think, we wanted to open up the floor to welcome any of our global leaders that are on with us today. I know that we have Vanessa from Spain joining, and she was going to come on and chat with us a little bit about what they're doing and kind of how they're moving their work forward. And we welcome any other of the global leaders who are here to join us. Celeste, I see you there. So you'll get an invite to join us on camera if you'd like. But really, again, we want to hear about how you're moving the space forward, whether it's, really helping guide families. SCN8A Spain has a lot of really cool things that they're working on. So let's see. Hopefully Vanessa can join us in a second. Oh, great. We have people weighing in. I did put in the chat, like, what 2025 meant to all of you. What happened in 25 that was meaningful? What did you learn? What did you experience? What did you achieve? Because we want to hear from all of you, too, about what the SCN8 experience is. Yeah, it's a shaking experience to get this kind of a diagnosis. But as Michael said, I think it's so powerful that we have such an amazing community coming in to work with us, that working together to build a network for all of these families. So, Vanessa, welcome.
Hello.
We're glad
Thank
to
you
see
very
you.
much. I thought Aurora was going to introduce herself first, but I think
No?
she hasn't got
Oh, she hasn't come
the.
in yet. Okay.
I don't know if she can speak or if
I'll
she
see if
can.
she's here. Aurora. Ah, yes, I'm going to make
Yes,
her come on.
yes.
Come on,
So
Aurora.
she is the president.
Yes. And her
So she
English
has
is much better than a lot of our Spanish. So,
to talk first, and then I talk about that
okay,
after
terrific.
her. Aurora, it's your turn.
Hola. Oh, Oh.
Microphone.
Ahora?
yeah, perfecto.
Hello, everyone.
Hello, Aurora. Welcome. Very happy to see you.
The same for me. Yes, so I'm going to read some paper I have written
Okay.
because my English is awful. So, but first of all, I would like to say that I'm very, very proud of being part of this community. You are all very nice for me. Gaby, Hayeta, Michael. So I'm going to introduce myself. My name is Aurora, and together with Vanessa, I founded SCNHA Spain. I have a daughter named Maria, who is now 21 years old. She began having epileptic seizures that we were unable to control when she was 2 years old. She was diagnosed at the age of 11, very, very late. It was a very hard work to be diagnosed. At the age of 8, she experienced a severe regression, and when she was 15, we started a clinical trial with fenfluramine. Fenfluramine was miraculous for her. From having 60 seizures per month, she went down to 3 or 4. After 5 years on fenfluramine, she began to have more seizures again, so we started cenobamate. She now has about 5-6 seizures per month. While I was in the clinical trial, I met Vanessa, and encouraged by our children's neurologist, we created the association, SCNHA Spain. So go ahead, Vanessa.
It's my turn. I'm going to be very short. So my name is Vanessa, and together with Aurora, I founded SCNHA Spain. My son's name is Joan, and he's now 15 years old. He was diagnosed with SCNHA at 5 years old. And I met Aurora during the fenfluramine clinical trial, and that thing changed our lives. So, however, some of you know that 2 years ago, I repeat Joan's genetic test. Michael Hammer told me that perhaps it was a good idea to repeat it because there were some things that were not clear identified with SCNHA, and the diagnosis was changed. Joan does not have SCNHA any longer. He has a different genetic mutation, and it was a diagnostic error. But even so, I continue working for SCNHA Spain. Working for this community makes me feel very good, and we have achieved so much things since we start 4 years ago that I can't stop collaborating with the community, and I feel very supported by the community also. So we are going to share a small video that we have made, so you can see the things that we have achieved this past year, and that's why I can't stop working with the community. I try to share my.
I think we have the video pulled up too.
You have to? Okay,
Yes.
see if you want to, or I can put it.
Yes, so we'll have that pop up, which is wonderful. Okay. You guys have done an incredible job in Spain, and we know that
it's in Spanish, but it's translated to English.
Yes. Okay, we need the sound.
SCN8A es un gen esencial para el correcto funcionamiento del cerebro al permitir que las neuronas transmitan señales eléctricas. Cuando este gen presenta una mutación, puede provocar epilepsia y graves dificultades en el desarrollo. Ante esta enfermedad, las familias SCN8A del mundo nos hemos organizado para luchar juntas y colaborar estrechamente con médicos e investigadores, con el objetivo común de avanzar hacia una cura. SCN8A España agrupa a familias españolas y de Latinoamérica unidas al compartir un idioma común. En 2025, gracias a donaciones de familias y organizaciones hemos impulsado importantes proyectos de investigación. La creación de un ratón SCN8A, en colaboración con la Universidad de Emory. La generación de células madre pluripotentes inducidas para estudiar la enfermedad en neuronas humanas y probar terapias génicas personalizadas. El apoyo a un proyecto de una madre científica en la Universidad de Tufts. La colaboración con la Fundación INCE en España, aportando información clínica de nuestros hijos para avanzar en la investigación. La cooperación con la empresa argentina Boolci, que aplica inteligencia artificial para descubrir nuevos tratamientos. Además, hemos participado en el reclutamiento de niños para un ensayo clínico prometedor facilitando información a las familias. La investigación nos acerca a un futuro con más esperanza. Las familias SCN8A unidas somos el motor del cambio. Juntas, podemos marcar la diferencia.
Gorgeous. I love that. This is a beautiful video. And maybe just quickly, let's just mark that you all have started to do incredible work from Spain and using the very difficult money it is to raise as a foundation to really advance science. And I know you've been working very closely with the Dreve Foundation in Spain that has done a ton of work and partnered with them. And it's so incredible to see. I remember a few years ago, you guys were getting started and getting your feet wet. And now you guys are just this powerhouse foundation that's doing amazing work. So I'm very excited to see that and to celebrate with you and work with you. You guys are incredible partners.
And we are thankful to the Alliance and to all the other associations in also the Europe Federation, because we need to collaborate with each other, because Spain at all will not do a lot of things, but if we do things together, I think we are stronger together. So thank you very much to all of you.
Yeah.
And Gabby, we love you a lot. And we are very happy to work together with you, with all of you, Gabby, Hayeta, Michael, and we are very happy that Casey Craig and you are working together, because I'm sure we are going to do a lot of very good things together. Thank you.
Yeah. Well, speaking of Casey, why don't we bring Casey on too? And maybe we'll talk a little bit about this collaborative grant program that we're working on together, which I think is, as Michael demonstrated in his slide, and as we talked about here, the collaboration is one of the most important parts of the work that we're doing to advance the SCN8A, space together. So, I think one of the most exciting things that we're launching in 2026 as a global community is this joint grant program where all of us who are signing on, I think we've got 6 countries or 5-6 countries and groups that are coming together to pool our money so that we can fund critical and innovative science. And this was a dream 2 years ago, and all of us working together, it became a reality, because we know that we're all fighting for the same thing. Our amazing children that are here with us, those that have gone, and those yet to come. So this is a mission that we have to get us closer to better treatments and cures faster. So I'm so thrilled that Spain and TCSF and the UK and Ireland group and SCN8A Netherlands, we're all going to be working together this first year to launch this grant program, which today is the official announcement. And I think in about early March, we will have all the systems open, and Casey and her team at TCSF are helping kind of build out the campaign and the website. So Casey, anything you want to share and add? I'm so glad you're here with us today.
Yeah, hello everybody. Yeah, I think, TCSF, we're really excited not only to collaborate, but really to see the different projects that might come out of this and help push research forward for our SCN8 community.
Yeah. And we kind of dabbled in talking a little bit about this at AES this year. And there were a lot of people that were like, we need this. We know this is such a hard time right now for funding for labs and science. So I think we're going to get a lot of really impressive applications in. And the beautiful thing is that as we're all pitching in, we'll be able to fund more of those, right? And really see the field advance. Michael, what are your thoughts on this grant program as somebody who's been, in the scientific space for since 2012, really?
Yeah, no, this is a big step forward for us. Something we've been wanting to do from the beginning. It's not going to fund a whole laboratory or, multiple people, but it's going to be an important bridge or seed money for a postdoc or a young talent that's doing something really innovative in the field, maybe to bring someone new into SCN8A that's working in another area that's doing very exciting things. So I feel like Casey said it perfectly. We look forward to seeing what we're going to catch when we throw the fishing line in the water, and we're going to pull out something great, I'm sure.
Yeah. Terrific. Well, please stay tuned. There will be a lot more information out in a couple of weeks about the grant, but if anybody wants to start thinking about it, it's really going to be centered around the roadmap. So Kelly can drop the roadmap publication into the chat in a minute, but essentially that's what we're united around is this need to fill the gaps in SCN8A. So you'll get more details soon, but if you want to start brainstorming and thinking about it, that's a great place to start. And we look forward to a lot of really wonderful applications, and we'll try to fund as many of them as we can. And this program will only grow as time goes on in the future.
Might want to say one more thing
Yes.
about the grant is that we've built the foundation, the roadmap for where we need to fill gaps. We've done already. We did this last year and published this paper last year. Amazing effort on behalf of all of us to just define the gaps in our knowledge about SCN8A and the mechanisms and the way to treat it. And we have a roadmap. We're not limited to the roadmap for the grant because we might find people out there that are doing things that are off the roadmap that we want to fuse onto our roadmap. So it's all part of a stepwise process to get us where we need to go.
Yeah. Yeah.
Yeah, I'd just like to add that even though the funds aren't sufficient to support a major project, a comprehensive study, or a major new initiative in a lab, the early grants that we did went to young investigators early in their career, and it made an enormous difference. And they're in the field now. Those people who got those grants are now heading their own labs. So the leverage of our coming together to do 2 or 3 of these could be the new leaders in 3-5 years that are making the breakthrough. So it's another benefit of our pooling our funds and getting more support at this time when funds are really tight to keep those committed early investigators in our area.
Who then become dedicated, researchers. So amazing. Well, thank you, Aurora and Vanessa, for joining us. We are so excited about the work you're doing and the work we will do together. So thank you for being with us here today, and we love working with you.
Gracias.
Yeah.
Muchas gracias.
A ti. Ciao. Okay, so we want to jump in now to talking a little bit about kind of where TCSF and the Alliance are moving to kind of build on our collaboration. We've been talking for years about different ways that we can collaborate and share more with the community about who does what and how and all of that. And so we've been talking a little bit about that for a while now. So Casey, we're excited that, this year, again, like we're always so busy. There's some 1.5 million projects going on. We've got kids that need a lot of attention and care. But you and I have committed this year to really doing some stronger mapping for the community. I don't know if you want to say a few words about what we have in mind.
Yeah, well, and I think one thing just to point out, you talked about us having lots of projects and lots of going on and our kids at home. And we understand that the parents and caregivers are out there too, and the patients that are coming out that are, self-care and it's just a lot, right? The journey of SCN8A is a lot. And so I think anything that we can do to help families find the resources they need in a shorter amount of time is going to benefit our whole community. So I think that's one of the things that we're looking at with the mapping is trying to figure out, okay, who does what and where can I find these resources as quickly as possible so they can start implementing those resources quickly.
Yeah, for sure. And really documenting how there's so much synergy, right, in what we're doing. You know, TCSF has a very clear lead on doing certain things, and Alliance has certain leads that they do, and we all kind of have a place in the space, and we really work hard to make sure we're not duplicating efforts, because we know there's so much to get done, and we don't need to replicate where it's not necessary. But you know, I just appreciate that. You know, you guys have been great partners. You know, we've really worked together in the last couple of years, and as Jada mentioned at the top, it was really really lovely to get to join you and Hillary on the stage at the annual gathering to talk about ways that we're building a better future for our children together. So I'm really excited about where we're heading. And you guys have something amazing you're announcing today too. What are you guys launching on
Yes.
Thanksgiving?
So we are launching for our, oh my gosh, how many years? I need to think about this. One, two, three, fourth. I think this is our fourth year for the Connor James Smith Patient Assistant Grant. And so we always launch it on Awareness Day. Oh, thanks, Kelly. She put the link in the chat. So what this, if you haven't heard of this before, it is a partnership with TCSF and Sean and Krista Smith. And when they lost Connor, they made a promise to him that they were going to help out our community as much as they can. And so between the funds of TCSF and Krista and Sean, as well as extra fundraising efforts that we do throughout the year, every single dollar that comes in under Connor James Smith goes straight back into that grant and is spent on families. So just to give you an idea, last year alone, we had 18 grants that we were able to approve and fund, which was over $50,000. So it is so rewarding. It is absolutely probably my favorite thing of this job is being able to have these applications come in from families that they've been told numerous times no. Right? Insurance, no. Other grants, no. And so for us to be able to say yes, and for our 8A families to have a place to go, to be able to ask for this help. And I'll just kind of throw this out there too. It doesn't have to be, therapy or medication or equipment. If it's something that's going to bring your child joy and is going to bring your family joy, we are welcome to those applications too. So we've done visual bubble tubes. Who has $300 laying around to be able to do this bubble tube? But we have a video of a child that came home and the visual bubble tubes going, and his whole world lit up. And so we have all different kinds of things that we have granted in the past. And if you have any questions on would this be considered or not, feel free to shoot me an email, casey@thecutesyndrome.com, and we are more than welcome to chat about it. So today the grant is open. Head to the website, fill out your application, shoot me an email if you have any questions. But we're pretty excited to see what 2026 brings.
Amazing. It's been so beautiful to see what has been provided for families, and the joy and Danielle is reminding everybody it's international. So anywhere in
Yes.
the world, share your what you need, what you want, what you would love for your child. So it's so beautiful, because our kids, we have to fight for everything, and giving them something that is just about joy or helping give them access to something is really an amazing gift. So thank you to the Smiths and to you, TCSF, for making this possible.
Absolutely. Yes.
All right. Anything else you want to share? I mean, I think we've got a lot ahead. People will get sick of us soon, because we'll be talking a lot and putting out a lot together. So more soon, I would say.
Absolutely. Stay tuned.
Okay. Amazing. Thanks, Casey, for joining us. All right, so next up, we're gonna welcome Kalie Reever, who a lot of the community has heard of and from because her and the team at University of Virginia in Manoj Patel's lab had some really exciting breakthroughs last year. So we just wanted to invite Kalie on to share a little bit about what you're working on, what you're excited about. This is something that we have to mark as one of the most exciting things in the last year that's happened in SCN8A, I would say. So, we will, I think we have a link to your, what you guys put out, your paper, but there's a lot of, well, tell us, I'll let you, 'cause you have the words to say it. what
Yeah,
you guys have found.
thank you so much, Gabby. Thank you guys. Thank you, Michael and Jayetta as well. And want to thank Aurora. She stayed on. We got a little bit of funding for her for a project. So
Oh,
thank you
wonderful.
to all the European groups as well who have been supporting us. It's not just USA, it's all
Oh,
over, it's
absolutely.
global, and that's what it takes. So just to share, we've also gotten our paper out, officially published in press. So that is on PubMed, which is just a general site for academic papers. It is able to be searched just with the terms SCN8A base editing. So to find that paper, you just have to search those 3 words, SCN8A base editing, and it will come up with more information. But in essence, we are sitting here doing genetic therapies for SCN8A, pardon me, DEEs. We're not just focusing on one mutation or just on gain of function or just on loss of function. We're trying to do right now as many variants and as many kids in this population as we can. So we started off having a lot of success with one of the most recurrent variants with SCN8A DEEs, and we've been moving into the other more recurrent variants. We have a lot of great preliminary data for another variant, 1617, at that position for a base editor for that site. So hopefully we can get more data about this, get some safety evaluations going for this variant and the others as well. So we're working on a total of 7 right now. And we're really excited to hopefully expand that and see what we can do. We know that SCN8A DEEs are caused by that single base mutation in SCN8A. And what we're doing as a lab is taking these gene therapy techniques and targeting that single base mutation, that variant, to turn it back into what we would have typically as a patient. And so what we're doing is trying to figure out how, by changing this variant base back into the typical patient form, how we can do this in a translatable sense. So we're really focusing on bringing these therapies into the clinic. We're working really hard. We've started a company called Stallula Therapeutics to hopefully be able to bring this to the market in 2 families, because that's who Manoj, Dr. Patel, and I work for every single day. So we're really excited that this paper has gone out. We're really excited to share with you guys in the future our success with more variants. And I will be hopefully definitely applying. The thing I'm most excited for is that grant that you guys are talking about. I mean, what I'm doing and what our lab is doing is so exciting. It's so high risk, high reward, and it's the new fancy thing, right? But the grants that you guys are putting out, you guys were mentioning earlier, I think are really important to the research community. I myself, with that paper out, am eligible to graduate and want to do a postdoc position so I can stay here and just be hyper focused. And as you know, funding is hard, so we will probably be going for that to enable me to be able to stay here for a few more years before we can get those millions of dollars it takes from venture capitalists to really get this company going. And that's where we're going to be looking for those millions. We do not expect the families to have this money to fund this kind of company.
No.
But to get these VCs money, we need a lot of great data. And so that's why we're here every day working as hard as we can to get that. Hopefully we'll be able to apply for that grant and I can stay here for years, just keep on doing what I'm doing for this foundation, these families. So we're really excited about our work, and we thank you guys for all of your support that we've seen. It's just been outstanding.
Yeah, it's phenomenal. It's such an exciting breakthrough for families. We did a survey of families in preparation for our roadmap meeting, and I think 75% of families said they are very interested in seeing a gene therapy, and you're getting us closer to that. So
We're
I
working
think
really hard, I
I know you
promise.
guys. Yes, I know you work many, many hours, and we're so grateful for the time and the passion you have for our community, because that's really what drives this innovation and the hard work. So
It's a passionate community. It's hard not to be. When it's a small community, but everyone cares a lot. And because of that, it's hard when you meet all these families and you get into this. It's hard not to care and feel like you're part of the family as well. So that I know that Dr. Patel has felt that, and he's brought that feeling onto me. So we're definitely here working for the families. That's our goal.
Well, we want to keep you in the community as long as we can, Kalie, because we know you could go anywhere and do great things, but we want to keep you.
I want to be here. That's where I
Yeah,
want to be here. There's nowhere else I'd rather be with people like you
awesome.
guys.
Thank you. That's awesome.
Thank you guys for letting
Amazing.
me speak.
Thanks, Kalie. Great to see you, and thanks. Keep up the great work.
Thank you guys so much.
All right. Well, we are running through very quickly here. There's so much to cover. We only have 2 hours. Our goal is really to bring you lots of little tidbits of information about what we're seeing, what we're doing, where we're headed, and what's exciting in the space. So I think right now I'm going to ask Kelly to join us. Kelly is the deputy director, and she is an integral part of all the work we do at the Alliance. She helps things move and run smoothly, and we're so grateful for all that she does for the community. And she's, people know that Raquel was with us for just under a year, working as science and research director, and she got an offer for a job that she couldn't turn down, as she said. And so she actually went over to Praxis to help continue working on great treatments for our community. But Kelly has been integral in jumping in to help us keep all of our SCN8A programming moving forward. And some of the most exciting things some of the things that we're most excited about in SCN8A are really this collaborative research network that we're building. So, Kelly, I'll let you introduce yourself first, and then maybe you can tell us a little bit more about all the elements of the collaborative research network.
Yeah, definitely. So I'm Kalie Muzichka. You've probably seen my name places before from emails at conferences. I've talked to many of you. I've been with the Alliance for about just over 2 years now, and I've loved every minute of it. My background is in medical anthropology, so I got my PhD studying racial disparities within total knee replacements and how different outcome measures and social network measures can really help facilitate healing in those different surgical procedures. So I have a really strong background in survey research, understanding health problems, cross-community understanding of different issues. And so that's kind of the lens that I bring to this work. And I've really enjoyed being here for so many really, really exciting things. So, when I was hired, we did not have an official collaborative research network yet. And so it's been really, really cool to see that get built out and really formalize some processes we already had in place and implement new ones. So we have the caregiver advisory board, part of the collaborative research network. We have the clinicians network, which we'll talk about in a little bit, so I won't focus too much on that, but there are some really exciting programs coming out of that clinicians network. The industry advisory board, of course, we are working with industry to help them better understand the community, help better communicate our needs to them as well. Of course, research, the Scientific Consortium and Research Network. And we are really excited to gather this network together in person in Orlando this year at the Research Roundtable Joint SCN2A, SCN8A Research Roundtable that will also have part of our CRN meeting in person. So that is me. That is the Collaborative Research Network, CRN. And if you have any questions about it or want to learn more, I'll drop the link to it in the chat. And I'm also available via email if you have questions too.
Yeah. And I think this is, so people know the context of this. This is building on a lot of work we've been doing over the last, particularly 5 years, in terms of building stronger networks for clinicians and researchers and thinking about how we can really push forward the field by, breaking down silos between all of these groups, including families. And we got a grant from the Chan Zuckerberg Initiative, one of their Rare as One grants, that is really investing in our organization to build kind of sustainability and improve our kind of what's the word, Jade? I'm forgetting.
The professional standards and operations, a real fiduciary responsibility that we're not just patching things together, but that we have really working toward a world-class patient advocacy organization that will last and keep going. Because while we hope for important and big answers soon, we've seen with Dravet and other more well-funded organizations, it takes a sustained effort that you make good increments, you may get new treatments, but maybe they're not the best ones for everyone. So that's really the core of it, is that focus on sustainability.
Mm-hmm. And keeping all of our, when you're looking for a cure, you can't really follow one road. You've got to keep a lot of eggs in a lot of baskets. So this is helping us, really continue to think about, and the roadmap, which we will continue. Michael led the charge to really get that paper out, really consolidating everything that happened at our meeting and all the thinking of these many, many clinicians and researchers who volunteer their time to be a part of the work that we're doing. And that is continuing to evolve. That is not a stagnant thing, right? So for this summer, we will be meeting, as Kalie said, in Orlando. We're doing a joint scientific meeting with Families SCN8A. And as part of that meeting, we'll be revisiting the roadmap. What's changed? What's improved? Where have we made progress? Where do we need to put more energy? And so, this is going to continue to evolve and be very fluid as the needs of the community change. So I think, and people might be thinking, oh, there's different meetings. TCSF has their meeting in December every year, which is amazing. And this is kind of a meeting that we do in conjunction with our grant from CZI that's really critical to bring together key stakeholders to map out the future of SCN8A research and science. So this is a workshop really focused on moving the science forward. And if people are interested in learning more about that, please reach out, as Kalie said. So, all right. Anything anybody wants to add there before we keep moving? Hopefully people aren't getting dizzy. Thanks, Kalie. So I think we're going to go ahead and invite Brian Pfister on, who is, many people in the community know Brian Pfister. He was introduced to us when he worked at Praxis. Brian has close to 30 years of experience. Sorry, Brian. I hope that number is not too big of a number to share with you.
Yeah, no. It's good. It's good. I think it creates the idea of longevity. It creates the idea of commitment, to seeing these things through. And for me, like there's been no greater inspiration in a lot of ways than what Michael Hammer has done. And so this just my own, kind of heartfelt, thank you to him personally and what he's done for SCN8A and what he's done to inspire me from a professional standpoint to continue to look for solutions and resources and to not give up. And I always like to tell people it's kind of doing the hard things every day. So it's easy to do the easy things. It is so hard to do the hard things. But if we do those hard things every day, we can make somebody's everyday a little easier. So just again, to Michael, I mean, I can't tell you how many times we've spent hours talking and pontificating and thinking about the deep science. And had it not been for what you've done, I probably wouldn't have been here, to be honest, because it's getting that deep understanding and that knowledge and really understanding, for me, what the impact of families is. My son has epilepsy, a different form of epilepsy, but there's a certain kindred spirit that we all share. And I just want to say thank you, Michael. What you've done has been inspirational on the highest levels, and even to continue to work while it's not what my day-to-day job is, but to continue to be part of this and have that passion and commitment. It kind of mirrors what you've done to some extent on a lesser scale, but thank you so much for that inspiration.
Oh, Brian, man, that's awfully kind of you. And we've had so many hours and great conversations. I really respect everything you're doing and the work you've done in so many ways. It's so great to have you on the board of the Alliance now. So I guess we're supposed to have a little chat, right?
Yeah, I'm going to leave it to you guys to have a
Sure.
little chat and then we'll join back in a few minutes. But yeah, you guys dig in and have one of your chats that brings us in a little bit to see how you guys connect and really keep the juices flowing and helping us think about how do we move forward SCN8A. So
Yeah, I think that's for me is like when I look at this and think about when people say, what does this look like from a researcher standpoint? What does this look like from a scientist standpoint? I think talking to people, especially talking to you and understanding what you've seen from patterns, like everything is when we look at the stars in the sky, it takes a special person to find a constellation of symptoms or constellation of stars that really paints a different picture. And so, you've done that and you've helped me. And I just wanted to kind of like pick your brain on that. Like, as we continue to move forward, what things in the stars do we need to look at differently to kind of how do we accelerate this on some level? Now that we're getting closer to better medications, better treatments, what can we do to accelerate this?
Yeah, I mean, I think that was the main question we asked during the roadmap is how do we leapfrog the field forward? And I don't think we know exactly where the next breakthrough is going to come. So I wanted to cast a broad net in that process. So there might be neuromodulation methods and other things that come in the picture that we're not even thinking about right now. So we did include some of that in the roadmap. I mean, we're all very excited about genetic therapies. We know it's going to take a little while to get those out there. But we also know that seizures aren't the only symptom that we're trying to cure. And most new pharmaceuticals and gene therapies tend to think of it as a seizure disorder, but we know it's way more than that. So I think the stars tell us that there are many constellations in the sky, and we can't just focus on one. And so I've been trying to think about, how do we leapfrog the field for better treatments? But what can we do better now with what we have? Because what we have now is probably going to be the mainstay for the next few years. And so one of the working groups in the roadmap was doing better therapies with what we have now. And it was working group 3. If you read the paper, you'll see it there. And so it's basically like using all the data we're getting from families and caregivers and looking at what their assessments are of what's working, what's not working, and trying to use a scientific process to hone in on. It's a very, everyone's taking a cocktail. So, from a scientific perspective, there's no control experiment. It's complicated. But trying to pull the signal out of the noise in terms of what medications are doing a decent job right now, and using computational machine learning methods to try and identify not what we see with our eyes, but what the whole picture is, which is very large and millions of data points. Yeah. Having said that, going back to this other idea of comorbidities, if we do better treatments, do we also get better resolution or mitigation on the comorbidities, the pulmonary, the GI, the ataxia, the hypotonia, all the comorbidities that go on, learning and speech? How do we make those get to be better? And so when you look at it all, it's a little overwhelming, but there's a way to organize it into a system that we can do one by one to try and get there.
And I like that. I think you hit on a couple of things that really near and dear to my heart, and kind of how we found out my son had epilepsy was we looked at the cognitive function. And so there were certain subtle things, right? So language acquisition, receptive language versus expressive language, and even kind of going back a little bit to like kind of take the idea of language out of it, but more of communication. Right. So there can be communication, engagement, and awareness and those type of things. When you see it as a parent and you see, hey, I don't think something's quite right, I think that the understanding how to describe that is important to clinicians. But when we look at drug development, in understanding that impact to families is huge. So as we think of the collective family community, those experiences, those lived experiences are very important for people to really qualitatively understand what they're seeing clinically. And then to understand too, like you mentioned, the cocktail idea. I think even what you'll see with gene therapies, whether it's CRISPR, Cas9, gene editing, whether it's antisense oligonucleotides, is I think that you'll get an idea of changing the phenotype. So genetically, we have a particular predisposition, but phenotypically and how it's seen, how it's expressed, and how we interact, we might be able to incrementally move those forward. So things like prognostic index and in looking at these, can we move up a level or two with the therapies, and then which ones actually give us the greater likelihood of moving and in creating better communication, creating better awareness, creating just a better quality of life in general. And for us and from my standpoint, that's where industry can do better. And I think that what the families have shown us helps us to begin to grow and to develop that, to look at even better clinical trials, that are measuring what we want them to. So again, it goes back to what your work has done to show that, because it tipped us off back in my former life about how we can look at this and look at some of these qualitative scales.
Yeah, so there are a lot of interesting things that you bring up. One is, what's the connection between the actual gene dysfunction and the lesion? I call it the primary lesion, and all the downstream injury that it causes. If you look at it neurologically, SCN8A sits on an excitatory neuron, and it's the neuron overfires, and it causes, what happens? I always ask myself, when Shay was around, I go to the doctor and I say, "Are the seizures damaging?" And he said, "Don't worry about tonic-clonic seizures. They're not damaging the brain." I never quite understood that, because when she had tonic-clonic seizures, she regressed, and it took her a while to recover. So I knew there was something more than just the lesion at the gene, as the primary and the only factor that led to the regression, which the regression was in all the different ways: cognitive, expressive language, even gross and fine motor skills. So I knew there was some bigger picture there. And so just to cut to the chase on this particular aspect of what I'm thinking is that there's a downstream injury cascade downstream of SCN8A. Neurologically, it goes to the next neuron and the next neuron, and it activates all these other types of channels. So there's NMDA and there's AMPA receptors that let calcium into the cells, and that happens, and the mitochondria are affected, and that can lead to microglia and astrocytic activation and blood-brain barrier dysfunction and sleep disorders. So they're all connected in some kind of tetrad of things that they're like positive feedback loops. It's like if you had four thermometers in your room, which one would you turn to get the temperature where you wanted? You'd have to adjust all of them. And so I think that, cutting to the chase again, I think the earlier you treat a patient who is very young and very newly diagnosed, let's say with one of Kalie's gene therapies, when they come out, the better off you are at not having all those other things arise. But when we've had epilepsy for a while, for years, we might need to think about secondary treatments. And I think Kalie put something in the chat about that. There's pathway targeted, there's gene targeted therapies, and there's therapies that will come that will target some of that downstream injury. We published one on candesartan. It's an angiotensin receptor blocker. It helps the blood-brain barrier, and it helps the mouse model do better. So there's so many different ways of attacking this, but I think for the families, the thing to know is the longer you've had epilepsy, the more we need to think about multiple ways of attacking it. And developmentally, when you're delayed the first year, that makes it harder to catch up later. So we want to get it as early as we can.
Yeah, I agree with you. And we saw that was, again, one of the primary drivers for my son is there were issues with language and communication. And where I said, hey, I think there's something going on. We picked it up in a 24-hour EEG that we were missing kind of in the earlier, shorter term. And I said, this is interrupting the hippocampus, so long-term potentiation. So what we saw is a phenomena. He would gain a word, use it all day, go to sleep, next day gone. Wasn't even there for retrieval. I'm like, there's something going on. And so I think understanding that clinical, presentation, this underlying like sub-threshold seizure activity that maybe you're not picking up on a daily basis that actually is happening all the time was key to slowing that. Because what I've seen in other research and other conditions too within epilepsies is that when you have more seizing activity and more activity in those tissues, it recruits down into like 6 or 7 layers within the brain tissue. So it kind of creates gathers its friends together, if you will, in a way, and creates a much, much worse situation. So I think finding it early, looking at interventions and a multi-targeted approach, both, pharmacologic as well as then some disease modifying, if you will, I think is really a good approach. And even if we learn, incrementally about it, I think it adds to the science. It adds to, researchers then saying, hey, this is interesting. And you mentioned the ACEs and the ARBs. When we looked at some of the data, I was quite astonished to see how many cardiovascular drugs were actually being used in standard of care with our kids. I was like, okay, this actually gives me some idea of, you talk about sleep, you talk about the whole host of systemic kind of function. There's a lot going on. And I think that the more families understand, and again, your work has been instrumental in helping us, to understand and conceptualize this, the better we can do for the kids and the better options we can come up with, the more creative we can be. And then layering on the AI kind of component, AI is good at pattern recognition. So much better is they're good at statistics, they're good at running analyses, and they're really good at running the what ifs. And so then I spend a lot of time on these questions. So all the research that people do, it gives me more questions than answers, but that's actually good because that's kind of how the process scientifically works.
Yeah.
So, yeah.
You know what, Brian? It just occurred to me that we're obviously going to run out of time here, but we should probably continue the discussion and make it as public as we can. So maybe we should do a podcast, an SCN8A podcast.
I think that would be great. I would love to do that. I actually have a microphone I've used here for a lot of things that on the professional level.
Yeah.
I love podcasts because they're great, easily digestible, type of things. We can even move to TikTok Doc if we want. We could come up with some little vignettes and videos to help.
Yeah, let's do it. And we can invite guests to come on the podcast, clinicians and researchers, and maybe even tie SCN8 into other diseases, because I think that they all do tie. Some of these neurological disorders tie in, and treatments that might be for another disease might work for us. So I don't know. It's an idea. We should run with it for a bit and see what.
I think it's great, and we can develop a series, and I'd be more than happy to do that with you. I think it'd be fun.
All right. We might not make a lot of money if we do it, but it's not the point, right?
That's okay. If we can make lives better, I'm a happy man.
Yeah,
I appreciate
that's
that.
amazing. I love that idea, and we of course will help you in any way we can. But Brian, thank you so much for joining and having this conversation. I know you guys could talk for hours, and we look forward to hearing that on the podcast.
Yeah.
And thank you for joining the board and being a part of helping us move this mission forward. And you have so many brilliant ideas and such incredible energy and personal drive here. So we're just grateful for you.
I appreciate it. Thank you.
Thank you, Brian. You're great. Great seeing you.
All right. So as always, we're running behind because there's too many amazing things going on. But I'd love to have John Schreiber and Megan Abbott join us to talk a little bit about the work that they are doing with SCN8A kind of multidisciplinary centers and helping treat and care for our loved ones with SCN8A and really driving that work forward and looking at how we can improve. Hi. Thank you so much for joining.
You guys. Thank you for coming on.
Hey, John and Megan, thanks for making time.
Of course. Thanks for having us.
Yeah. Oh, I can't hear you, John. Let's see.
No?
Oh, there you are. There you are. Now we can.
Okay, yeah, good.
Just like a
All
delay.
right, no, great to be here.
Well,
You
I
blame
know.
the hospital network.
Oh, the Bear Air. Yes, I know that well.
Bear Air, that's right.
So, we invited both of you. You are two incredible pediatric epileptologists who have been working in the SCN8A space for years, treating families and young ones living with SCN8A disorders, and have done that work so much that you have been committed to building out better care centers for those living with SCN8A. And I know, John, we worked with you, was it 2018 or 19, I think, to get the SCN8A clinic set up at Children's National here in DC, really aimed at making sure that families can get more coordinated, broad care, right? A lot of families were not getting the multidisciplinary visits that they needed. And you, as a clinician who's been with us for many, many years in the SCN8A space, truly understand the diversity of challenges that families face. And Megan, as soon as you had the energy, you're like, I'm going to open a clinic and it's going to be for SCN8A and SCN2A. And it's been like so incredible this last year seeing how you worked that together and pushed forward incredible care that is, not just for, primary visits, but people who want second opinions and people who need, have a primary doctor that doesn't really understand SCN8A. So families come and meet with you annually, so I thought maybe we could just spend a little time highlighting how each of your centers work, what's going on, what you're interested in studying, because the reality as well is that we're going to be learning a lot from the care that you're giving families, because you will be able to then match that clinical data with the registry data that Michael has, with prospective data that Michael is pulling. So I don't know, John, do you want to share a little bit about kind of what things look like at Children's National here in DC?
Yeah, thank you. I got to say, it's great working with this group. I also got to work with Megan on an investigative workshop at AES a couple of years ago. So it really has been a pleasure to get to know her and the rest of this group. You hit the nail on the head. It's multidisciplinary care really is critical. We know that SCN8A and disorders that are like it are so much more than just seizures. These DEEs, as we now term them, also bring a lot of other neuropsychological, behavioral comorbidities, problems with sleep, sometimes cardiovascular issues, pulmonary and GI complications. There's so many different experts that you need to be part of that care to truly deliver, good care to these kids and meet people where they are. We have a multidisciplinary clinic at Children's National under our neurogenetics program for SCN8A. I focus a lot on channelopathies. And as part of that clinic, we routinely have our genetic counselor working with us that can help us with diagnosis, with testing if someone doesn't have that yet, or help with test interpretation. We do find sometimes people come to us with a diagnosis and they actually have something else. So they're a critical piece of our clinic. We also have a neuropsychologist that is dedicated to our program that works with us, and she's been tremendous and just helping us to get a better sense of where kids are performing, where they might be a little behind and need additional support, and just to get a better sense of these developmental profiles for SCN8A and other disorders that helps to inform research, for understanding natural history and helping with clinical trial readiness. And we also have access to lots of other expert providers, right? So GI, pulmonary, cardiology. We've been able to do some specialized testing in that SCN8A clinic to look for subtle markers for cardiac disease in these kids. And I think that still remains to be seen what other evaluation needs to take place there. And just a whole host of other specialists that these kids need to take care of them well. And we're also involved in lots of clinical trials. You've heard probably, I think, about some of these already. We participate in clinical trials for SCN8A and other disorders. We're involved in gene therapy trials for other disorders, and really are trying to position ourselves to be at the forefront of those kind of therapies when those things come online.
Amazing. Yeah, it's very exciting. And I've spent a lot of time at that hospital.
Yes.
So, all right, Megan, tell us a little bit about what's going on at Colorado Children's.
Yeah, and I think there's a lot of similarities, and likewise have loved working with John and this whole group, and just have really appreciated the way the SCN8A community has really adopted me since I became an attending. So I appreciate that. It has been very exciting that over the past year we've gotten to open the SCN8A multidisciplinary clinic at Children's Colorado. So it is housed kind of within what we call our multidisciplinary clinic space, which is a unique clinic space at Colorado where it's a large room for the patients to stay in, and different providers can rotate through that room. So even though it can be a long day of multiple visits with different providers, you get to kind of stay at your home base inside your room, and providers come to you, which I think is a unique, fun aspect of the clinic. We have multiple different neurogenetic multidisciplinary clinics, so the SCN8A clinic is kind of within that program. And I'm able to see SCN2A and SCN8A kids once a month in that clinic, and would love to see more kiddos over the next year. So we have different providers that rotate through in a day at the SCN8A clinic. So myself as neurology and epilepsy, I have a genetic counselor that works closely with me, a geneticist that also works closely with us. And then we have a rehab medicine doctor, Dr. Jordan Wyra, who's wonderful. And he really works with our therapists to see all the kids and get full evaluations. So PT, OT, and speech rotate through as well. And then we have a special care pediatrician, which I think is a nice other unique aspect of the clinic. She's a pediatrician trained in complex care, and so really does a nice job doing a full review of systems and making sure that all of the kids' needs are being covered adequately. And if we need to, we can pull in some of those other system doctors, like Dr. Schreiber mentioned. So like GI, pulm, cardiac, ophthalmology. If we need some of those things, we can definitely pull them in to kind of tailor the visit for each patient. Which is nice. And then recently I've added a child psychiatrist who sees kids as needed within the clinic. So if behavior management or behavior medications have been a concern or something that needs to be covered, she'll see kids with me in the clinic as well. And I think that's been really helpful over the last couple months. We function more as like a consultative clinic. So I see kids about once a year. Though if kids are local, I certainly can pull them into my panel and see them more often for epilepsy care. But in general, we like for patients to have boots on the ground. So if you're having a seizure in your hometown, people need to know about you, right? And so making sure that you have local providers who know about your patient and know what's going on. But, as the SCN8A multidisciplinary clinic, we're able to function as kind of the experts that can give unique specialized care and then advice to local providers should they need that over the coming year. So
I have a question for both of you.
yeah.
And that is the obvious advantage is, despite the fact that most families would have to travel, they'll get all this stuff looked at in one place. They'll, whatever it is they need, they'll get that looked at. What do you think, though, in long term, what could benefit us in terms of understanding sort of the bigger picture about SCN8A disorders or disease that can emerge as an emergent property almost of looking at multiple systems and multiple patients? What do you think? What might we learn that would tell us more about how all these things are connected?
Yeah, so when you have people who are seeing the same disorder, the same types of patients over and over again, you do start to recognize patterns, whether it's in terms of, the diagnosis or evaluation or other symptoms you might see that you might not otherwise recognize if you're only seeing 1, 2, 3 kids here and there. And that's true for, for us as the epilepsy experts, but also for our colleagues who see kids and might pick up on symptoms that we initially think is a one-off and come to find that it's a, common feature among kids. And then that may help to inform how we think about other system involvement.
Yeah, I think it's just been wonderful getting to work with a team. So I'm not working in a silo, but there's multiple providers seeing all these patients, and we have kind of a group room where we're all able to talk about the patients, and things come up like my rehab medicine doc will be like, "Oh, have you seen this? Have you been seeing this in multiple kids?" And so we're really able to kind of pull out patterns in that way. And I think that's even going to get better and better as we see more.
You can add me when
Yeah.
you want to.
That would also tie into some of the things we're trying to do that I'm sure we're going to talk about later is the grand rounds type of approach, taking complex cases and trying to get a bunch of experts in the room to analyze and maybe even, come up with ideas that are novel in ways of treating complex cases, but you guys will see those. And so that's going to be highly valuable. And maybe there's a way of connecting some of your casework with the grand rounds work, or we're calling it case conference, that we're trying to launch through the Clinicians Network and the Alliance.
Yeah. And I think that's wonderful. And whenever kids come see us in clinic, I always say, we're hoping to give you value. We're hoping to, help answer whatever questions you have, but you're also helping teach us. You're helping us learn about SCN8A and helping us aggregate data. And so I think the more we're all working together, the more some of those questions about multi-system involvement and patterns are going to emerge as well. just the other day, the child psychiatrist that just recently came onto the clinic emailed me and she's like, hey, have you looked at, the types of behavior medications that work best in SCN8A? Like, have you looked at those things? And so she's interested in asking those kinds of questions. And that's what's wonderful about working within a team, is that I'm not the only one thinking about scientific questions, right? There's multiple people thinking about these kids, which is wonderful.
Yeah, awesome.
It's very cool. And I think we're going to learn so much from this. And I encourage anybody who has a primary care that doesn't know a lot about SCN8A, but would, want to learn more, get second opinion, to visit one of these clinics. We also have a lot of other places where we have clinicians that know SCN8A well and act kind of as a way you mentioned, Megan, as like a consultative to help your home provider better understand how to care and treat for SCN8A. A lot of families are using the consensus as a way to also advocate with their home clinicians, but there's no replacement for actually having a clinician that knows. And so you guys have been kind enough too that when I have families that are looking for to get a consult with a clinician, that you've been willing to take those calls. So you guys are incredibly powerful advocates and in service to our community. It's amazing. One quick question before I let you all go is that one family wants to know, are there any requirements for children to come to those clinics that you have?
Yeah, I would not, so really it's just, call up and schedule an appointment. Sometimes there's insurance, requirements or things which our office staff can help deal with. And like Dr. Abbott said, yeah, we're here to be a support for you and if you're from afar, for your clinical team back home. So we want to be a resource for them, and are certainly happy to do that. But we can include our contact information, or perhaps you can include that, how to reach us.
In the link, she put a link in there that has information about both of your clinics.
Perfect.
And there's a question too about if they're international, remote consults that you all can do.
Yes, when we do have a global services program, which I can share some information, with you about that, perhaps.
Yep.
Yeah, I know my hospital's working on that as well. In the past, international patients have had, if you wanted to come, you have to be cash pay, but I think they're working on some sort of global consulting piece, but I would have to get more details.
Yeah. So if you have questions, reach out to us, or the information on the websites, I think, has contact information. Excuse me, the link. So thank you both so much for all you do for our community and the broader community who are struggling with these rare disorders that are all consuming for our lives. You guys are helping make it better, a little easier. So thank you.
And thanks for including us. It's wonderful to be a part of it.
Absolutely.
You're welcome. Appreciate it.
Terrific. All right. So we're bouncing around here as things come and go, as we're getting different people coming in. I'm going to invite in a new SCN8A mom to chat with us a little bit, Doris. And I'm going to invite you in, Doris. And then, Michael, you're welcome to stay on if you want to chat, or you can get a break in if you want.
All right. I'll take a quick break, but I'll be listening.
Okay, sounds good. Hey, Doris.
Can you hear me?
Yeah, there you are. Hey, so good to see you. How are
Nice
you
to
doing?
see you too. Tired.
That's kind of what this life is, isn't it?
Absolutely.
Yeah.
It's definitely exhausting, but
Yeah.
we get up and we do it every day.
Yeah, indeed. And you, so you are new to the community. You guys just got your diagnosis 2 months, 3 months ago? What is it?
He
Tell us.
had the West
Everett,
testing back
yeah.
in 2021.
Mm-hmm.
SCN8A appeared there, but at that point in time, from my understanding from his geneticist, is that since he didn't have infantile spasms, that we were not concerned about the mutation. You went black for some reason or something happened.
I can see you and I can hear you, but yeah, that's an unfortunate.
Yeah, I don't know what happened.
No, mostly I'm saying it's unfortunate about them saying that you have to have infantile spasms
Right.
with CNA, which is
So,
extremely false. But yeah,
Everett began having these like unresponsive episodes lasting around 20 minutes. Last spring was his first one. And after that, we obviously, whole bunch of hospital stays, whole bunch of testing. Genetics ended up doing a reanalysis of the West testing. And it went from, I don't know what the other part of it is, but basically it changed to SCN8A being pathogenic. When that happened, it kind of led to, okay, this is the direction you need to go. Here's the alliance. Here's Dr. Hammer. Find a neurologist that's familiar. Like it's, we spent a good 10 years trying to figure things out and searching for answers, and like nothing ever fit the picture. And then, and we've been down all the dark rabbit holes. Could it have been immunizations? Could it have been, baby food? So Everett is also level 2 autism. So we went all the avenues. We were like, okay, he also has a double mutation at MTHFR, which, later on you find out is not that big of a deal. But when we first found out, it was like, okay, what is this? And is this the issue? Is this what's causing it? Like I said, we've kind of been through the dartboard of diagnosis, the dartboard of specialists, the back and forth, no, it's not this, it's definitely this. Here's the referral, and then repeat. So when we officially got okay, this is what's causing the issues, absolutely, we hit the ground running. It was, I don't care what I have to do. Like, I will go to the ends of the earth to get my kids the answer he needs. Along the way, we also found out that I as well have SCN8A. Everett inherited it from me. We do have different phenotypes. My other children are now in the process of being tested, as they have similar issues that I have, that we're kind of pinning possible SCN8A. So it's been a crazy, 2-3 months at this point. It's
Yeah. So we're learning more and more about inherited forms of SCN8A, and more people are coming in finding that diagnosis. In fact, Michael's lab has been doing a lot of work on that with the registry, and Elise, who's on here, a clinical coordinator with Michael, is working on a paper about 5 generations of family that have SCN8A, and it's becoming a new part of the reality, understanding what that inheritance in SCN8A looks like.
Well, I can say that we do have family members that have passed from severe epilepsies, the assumed cerebral palsy, like way, way worse than Everett. We also have family members who have had seizures in the past, but have been told, oh, it's not a big deal. We do have a lot of health history with autonomic dysfunction. A lot of us have irregular heart rates. A lot of us have either been diagnosed with POTS or syncope or vertigo, or which I'm now learning could all possibly be part of this as well.
We're learning as we go too. I mean, it changes often.
It's been a lot of information in the last 2 months. That's for sure.
Yeah. Well, I mean, Doris, it's been inspirational seeing how you kind of jumped in, and I talked to you, and then like you're out there, you're saying this is what SCN8 is, this is Everett's experience, look at this is what's happening, trying to get,
because you never hear about it. No. Even Everett specialists that he actively see now, they have no clue what this is.
No.
They have never heard of it. They do not know how it affects him. So we ended up finding a way to collaborate care with Everett's previous neurologist, with Dr. Angel Hernandez out of Johns Hopkins, All Children's Hospital. He's not in Michigan anymore. He's in Florida now.
Right.
Which, let me just say, was nice because it's cold here in Kentucky. But, it was nice to sit down with a neurologist who fully understood, or, as much as he possibly could, what is going on. And that's not something I get elsewhere. Elsewhere, it's the family doctor at this point is like, what referrals do you need? I will take any advice because I have no idea what I'm doing at this point.
Yeah.
And we're kind of just winging it, and that's a scary point to be at, but it's even scarier to have the ones that aren't willing to learn and are willing to just say, no, it's not a big deal.
Yeah.
It's when it's unknown, it's unfamiliar, and when it's unfamiliar, they don't know what to do. I had somebody, so the other day, Everett had a cardiology appointment, and this was the first time he has seen cardiology since he was a baby. And I felt like the whole appointment was me teaching her about SCN8A. And of course, I got frustrated because, that's not my job. If you're going to see my child, you see it in his chart, you should probably look it up. But at the same time, like, it made me more aware of, I had a family member that was like, she went to medical school, not you. And I'm like, I agree. But when she went to medical school, this thing, SCN8A, wasn't a thing. So it's not as simple as saying, oh, you went to school, you should know what it is, because it's unfamiliar to everybody. So the struggle for care, for appropriate, proper care is definitely there.
Yeah.
We drove 900 miles to find it, and really at a wing of, I know we do have a referral for the UDN that I was over here listening about the SCN8A clinic, and I'm thinking, I wonder if that's a better option.
Yeah. Well, you and I should catch up again because I think it's just, you've done so much. You've jumped in and you've found specialists, and finding Dr. Hernandez is amazing. He's a great resource, but we're happy to kind of link you up with some other folks as well, and help you and Everett on this journey. Thank you for sharing your story here, online, advocating. Parents like you are what keeps us, moving forward, so that we're learning more about SCN8A and really pushing for better answers for all of our kids, because that's what they deserve.
Yeah, absolutely. And that's the scariest part about it is, as a parent, you have to sit back and you have to think, like, if this doesn't get funded, like, what does that mean for our children? The importance of that funding is more than just, they need a paycheck.
Yeah.
It's, this is the future of our kids. This is, especially in my case, with it being inherited, this is the future of my grandkids. And that hits a lot deeper than just, oh, my kid's autistic, or, oh, my kid's epileptic. Like, that's it. I don't know how. I'm great at writing. I really suck at talking. So
I don't think you do, but
I feel like I do.
No, it's a lot to juggle too. But if you want to write it all out too, we'd be love to share.
Always,
I think,
absolutely, all the time.
Amazing.
I made, when I decided to go public with all of this with Everett, like, a majority of his life and the neurodevelopmental issues that he has had, like, I have hidden my kid from the world. I didn't want the judgment of others. There was plenty of things that we kept hidden because, taking him in public and, treating a 5-year-old like he's a toddler, you get different stares and glares and comments, and you get to a point where you isolate. You feel like you have nobody understands, nobody is there, and the ones that are supposed to be, they're not. They will try to blame everything from your parenting to did you sneeze the wrong way while you were pregnant? Or my personal favorite is, did you get him vaccinated?
Yeah. Well,
to each their own. I will say Everett, though, is not up to date on vaccines, but, my other kids are. So, it's a lot. It's a lot as a parent. It's a lot as a caregiver. And there's so many of us out here that don't have support.
Yeah.
When I found the Alliance, it was like everybody reached out with a hand. It was, something I was not used to. I was not familiar with. I was pretty standoffish in the beginning, and then, Tammy and I had gotten really close, and I finally, for the first time, didn't feel like I was alone in this. There's still a lot of things going on outside of the SCN8A world that makes me feel alone, but when it comes to having issues with Everett or going through something myself, like I finally have an answer. A answer. Maybe not all of the answers, but a answer. And that means more than what words can say.
Amazing. Yeah, Tammy is incredible at welcoming families in and helping them feel less alone. And she has a wealth of knowledge about everything SCN8A and everyone in the community. So I'm so glad you were able to connect with her. Thank you for, I know we had a conversation recently, which was wonderful to connect. So let's stay in touch. Thank you again for joining
Absolutely.
here today and sharing you and Everett's journey and
No,
continuing to
thank
be an
all of
advocate.
you for everything that you all do.
Wonderful.
Like,
well, you're part of the journey now, so you're
oh,
part of
thanks.
Yeah. Well, we'll catch up soon. Thank you so much.
No
Appreciate it.
problem. Thank you,
And
Gabby.
take care. So one of the things that I want to build on there is this idea of autism and SCN8A, and Doris just shared how Everett has that diagnosis as well. We've had several other families in the chat talk about those kind of challenges. And we wanted to share an exciting development that we have that we are doing with the Alliance, and invite Maddie Ryan on to share a little bit about a project that she's going to be doing with the Alliance to help us learn a little bit more about SCN8A and autism. And before I move on, I also really just want to say that conversation with Doris just makes me think of how powerful these conversations are that we have with families all the time. We set up meetings at least once or twice a month with Dr. Hammer and families from around the world to talk about what's going on in their lives, to really catch up and hear what they're struggling with, what's working. And it's an incredible opportunity to be in community and troubleshoot and hear from other families what they're doing and what's working. And as Doris mentioned, we are often the ones that have to explain to clinicians what SCN8 is, and what we're hearing in our community is what works and doesn't work. So I think it's an incredible resource that we have these meetings, and they will be up online soon for you to be able to see all of the meetings and what they're planned for. But in the meantime, I'm so excited to have you here with us today, Maddie. Do you want to introduce yourself and tell us a little bit about who you are and where you are on your journey?
Hello, can you hear me?
Yeah.
Oh, hi. I'm super excited to be here. Thank you again, Gabi. But my name is Maddie. I am currently a genetic counseling student at the University of Pennsylvania. I live here in Philadelphia, and I'm also a Philly native. So I've been here my whole life. And as a part of my training, I have the opportunity to do a rotation or an internship with an advocacy group, and I decided that I wanted to be a part of the SCN8A Alliance.
Amazing. So you're working with us through a program at UPenn that links genetic counseling students with nonprofits. And when Raquel was here with us as our science and research director, we spent a lot of time talking with Michael about some of the different challenges that were coming up that we wanted to learn more about. And we thought it would be really spectacular to have somebody help us dig into learning more about autism and autistic-like features and challenges in SCN8A. So we put out a call, and you answered it very enthusiastically, and have some background working in autism. And do you want to maybe talk just a little bit about what the plan is for us to work on together?
Yeah, absolutely. So there's kind of really two big components to the project that I'll be working on during my internship. The first part is really going through that registry data to get a better sense of what autism spectrum diagnoses look like in SCN8A patients. And then the second big part is that we really want to get input from families into more of what that lived experience looks like for SCN8A families who have those autism spectrum diagnoses. So we're also looking to kind of develop some questions and some discussion topics to bring up in some of the upcoming family meetings so that we can hear from the family perspective as well.
Yeah. So I think that's, we're looking to really work this together and kind of like figure out where we're going. We'll be using registry data to help us begin analyzing and looking and see. We have a lot of families who filled out the loss of function form that Michael and his registry team put together. And that's going to be the basis we start off with. And then, like you said, building in more conversations with families to find out what we're missing, what we need to learn more about, and how we can continue to advocate for families who are managing, in this newer phenotype, with this newer phenotype of SCN8A. We still hear from a lot of families that say, oh, these symptoms, those aren't SCN8A. Your kid has too many skills, or your kid can walk, or your kid can talk. And the reality is that SCN8A is so much more diverse than originally thought amongst this like really severe population. And so, as the roadmap points out, we are really committed to really investigating more across SCN8A to learn how we can help families advocate and collect more data to show about the diversity in SCN8A and find better treatments and care for those across the full spectrum. So this is a really exciting development. We're so glad to have you with us, Maddie. And I think there will be more opportunities in the future for the community to come out and chat with Maddie, and we'll have an upcoming meeting that she'll join. So stay tuned. Thanks for being with us, Maddie.
Yeah, thank you so much for having me. I can't wait to get to work with you all soon.
Yeah, sounds good. Thanks. All right, we're flying through here. We're going to welcome up next Heather. A lot of you probably already know Heather Bentley from any number of different SCN8A meetings that we've had. And she is coming on as our SCN8A writer in residence. So she's going to talk a little bit about what that means, the work that she's doing, what she's studying, and how she's going to continue to be in service to our SCN8A community. So Heather, always a joy to be with you. Thanks for joining us today.
Right back at you. It's lovely to be here to share with all of you in recognizing SCN8A Day. And I love that we've heard all the different aspects, such a focus on the science, focus on the families. Thank you, Doris, for that personal story. And thank you, advocacy leaders and researchers and physicians, for everything you do. I am here with a very different role than ones I've held in the past. I am here as the writer in residence for the SCN8A community this year. That is a joint sponsorship between the three advocacy organizations, because we recognize that the whole life experience of SCN8A isn't just one thing. It's, as Doris said, all the things too that are going outside 8A that make us feel alone or isolated. And so I recently founded a group called Write for Rare, WRITE for Rare, with the mission of putting the stories in rare disease to work. And you've also heard today how sticky this community is. It's very hard to leave once you're here. And that is essentially what happened to me. That's how I know that stories matter, because your stories changed the trajectory of my life. So you see, in my last professional role, after a career in academic and drug industry-sponsored drug development, I had the privilege and the responsibility to lead the team that was running the first clinical program in SCN8A. I think you all know how that ended. The drug didn't really have enough oomph to continue. And at that point, neither did I. And so I chose um, to put my efforts towards the stories. You've heard from people working on the quantitative aspects.
Yeah.
I think, we have labs like Kalie and Manoj and the Patel lab taking us forward, advancing the science. But to me, something was lost, and I couldn't quite shake the feeling that the quantitative model was missing the richness of the life experience in SCN8A. And that is how I came to study narrative medicine. It is a discipline of medical education that that really honors the patient narrative, family stories, as, let's call them, co-equal forms of knowing, and really seeks a different kind of interaction between providers, researchers, and patients. And I hear this from providers as much as patients, and especially in this space where it's very difficult to pinpoint where the expertise really lies. And often, as you've heard, it is more with the families than with their local providers. And so this is a discipline, sort of a perspective from which we are launching a few offerings for the community. And I didn't know, I had some slides. We can show them or not show them, Gabi,
Yeah.
whatever. Oh, for me? For me, let me just take you through the slides. That'll be quick. I'm just going to leave you with my contact information and a teaser of some of the things we're going to be offering this year. And then I hope to chat with you, many of you, throughout the year. So let's see.
Yeah, and just while you're pulling that up, just stressing that this is a community-wide effort, that this is going to be in conjunction with all these partner organizations working together, the U.S. organizations, to kind of sponsor this work and give you opportunities to connect with families at many different touch points.
How's that coming through?
Yeah, if you want to go into screen, like share screen mode, there you go. Great.
Look good? Okay. So writer in residence, that's me, Heather, and that's my contact information, heather@writeforrare.com. This is a joint project among the community members. And really, we're going to do a series of things this year. We'll be offering narrative medicine workshops. These are for families. There is a version for researchers and providers, and some that we'll do together. But the first family workshop will be on Thursday, March 19th. Tentatively scheduled. Shoot me a note if that's something that's interesting, and I'll also put out a formal invitation later. What do we do in these workshops? We take a moment to look at art together. We lean into our aesthetic experience where the playing field for expertise is a little more open. And we approach a work of art, and it may be visual, it may be linguistic, it may be a poem, song, a piece of music that moves us, and that opens space for us to talk about our experiences in 8A and to witness for each other. So that's one way we do this. I'm also available for one-on-one story consultations, and have been doing this with various members of the 8A and also some of the 2A community. I kind of call this my story doula function, in which, if you are thinking, I got a book in me, or I really want to use this story to do something, we can just talk and see what that might be. Last year, I worked with Casey, and we published an op-ed about her experience with Stella and Medicaid, published in the Missouri newspaper under Casey's name. So these stories are your stories. I really am interested in helping you surface them. And that's what I mean about putting stories to work. We want to craft those stories in a way they can be shared for impact. Either that's your local community, perhaps it's your family, perhaps it's something else that you're trying to do with that story. Maybe it's the podcast. Maybe you've seen people at the family gathering in December and you think, I really want to tell my story, but gosh, can I? Well, of course you can. Let's talk about it. I offer writing support for community initiatives. I know, Gabi, that the Alliance has a lot of storytelling need for stories and that you use those for awareness, for advocacy. So I'm always available to help with those. And I am also working on a book project about SCN8A, tentatively called None So Rare. So those are all of the ways that we are trying to really elevate the stories in the community and witness for each other. So I would say, let's put your stories to work. You can reach out to me. I'd love to hear from you if there's a particular piece of art or poetry or prose or music that has moved you, has sustained you through tough times, or that you find as a source of joy. And I'll leave you with a short poem just to give you a taste of what it's like to step outside for a moment from our busy, busy lives. This is a poem by Ada Limon. She was the U.S. Poet Laureate 2022, and it's called Instructions on Not Giving Up. More than the fuchsia funnels breaking out of the crabapple tree, more than the neighbor's almost obscene display of cherry limbs, shoving their cotton candy colored blossoms to the slate sky of spring rains. It's the greening of the trees that really gets to me. When all the shock of white and taffy, the world's baubles and trinkets, leave the pavement strewn with the confetti of aftermath, the leaves come. Patient, plodding, a green skin growing over whatever winter did to us. A return to the strange idea of continuous living, despite the mess of us, the hurt, the empty. Fine then, I'll take it, the tree seems to say. A new slick leaf unfurling like a fist to an open palm. I'll take it all.
Beautiful.
Yeah.
I'll take it all. Instruction. We all need a little bit of instructions on not giving up from day to day, considering what we all manage. So that was really lovely. Thank you, Heather. I know we're also excited to work with you in the community, and keep your eyes peeled for more opportunities to work with Heather, and we will share her information for anyone who's looking, has a story they need to birth. I love the story doula analogy. So thank you so much, Heather. We're so lucky to have you in our orbit here. So I know we're running behind. We always do. I'm sorry, but we have a couple of more sections that I think are going to be really excited. Next, we have up a panel of scientists who are working in the SCN8A space, who have, all of them have been here for a number of years, 5 to 10 years, I would say, working in SCN8A, to share a little bit about what they're excited about, share about what breakthroughs they are working on, and kind of what lies ahead in SCN8A. So I'd like to welcome on, I think Kelly is bringing folks on now, but we have Chris Mackinson and Joshua Hack, and Ron Mall. There we go, and Ron Mall. Welcome. Hey, Chris. Good to see you.
Hi, how are you? Thanks for the
Good.
invitation.
Oh, of course. Really happy to have you join us today. I think that, you know, you've been around for many, many years, and it's really exciting to see how things have evolved for you and the work that you're doing. And Ron Mall, great to see you.
Thank you.
I
Great
know
to
that
hear.
we, both of you are previous grantees of the Alliance. I think 2019 for you, Ron Mall, and Chris, when was yours?
Let's see, it would have been um earlier, like 2017
I think so.
or maybe even earlier than that.
Yeah, 16 or 17, something like that, I think.
Yeah,
So,
'cause I was a
um,
postdoc at that time, so
right, yeah. So Chris Mackinson is joining us. He has a lab at Columbia University. Ron Mall is at UCLA and is a clinician and researcher in SCN8A. And Josh Hack has been working in Michael Hammer's lab for 6 years. What is it now? 6 years? Yeah.
Yeah.
So I am so excited to have all you join because each of you has a touch point in SCN8A that is unique, and you have been working on really pushing the science forward in a number of different ways. So if maybe you could each talk for 1 minute about the work that you've been doing most recently and how it's moving SCN8A forward. Chris, do you want to start?
Sure. Yeah, I'd be happy to start. So, as Gabby mentioned, I'm an assistant professor at Columbia, and I run a research lab that kind of has two major goals in SCN8A. So one is simply to understand what the gene is doing in development in terms of supporting how the brain works. And then the other is to use that information to test out what we call preclinical treatment strategies. So this is sort of like, the first and maybe the second step towards eventually getting something that could be used in a person. And so for that reason, we don't do, I'm not a clinician. I have a PhD, right? So our work is all in the lab. It's with mouse models. It's with human cellular models, like Ranma will tell you more about in a minute. And I guess in terms of the most exciting things that we're seeing right now, so one is that the human cellular models are getting much better. And so each year, it seems, there's a new way to take a cell from a patient and turn it into a neuron in a dish that resembles more of how that neuron is behaving in the human brain. And so that gives us the ability to look into, more of the underlying biology with greater resolution than we had previously, right? So I think just in general, that's an area that have been excited about since my postdoc. It's kind of what I moved to Columbia to start doing. In addition to our mouse work, that was really the new sort of area that we've gone into. And then I guess, we've been working on those models long enough now that we have some clues about some things that are working, at least in those models. And one of the most recent projects was it's sort of you can think of it as like a new type of drug, but it's a peptide, which is a protein, a very small protein, that when it gets into the cell, it interacts with the channel, with SCN8A. And whenever there's a problem with the gate, so that's the part of the channel that closes and keeps the sodium from going through, it's something that's very tightly regulated. It needs to open exactly at the right time. It needs to close at exactly the right time. And when there's an issue with that part of how the channel works, it can cause problems, and it's been identified in many patients with SCN8A. So this peptide actually is designed to bind to that part of the channel and to correct how it works. And so, we've shown this in an animal model. We're using it in human cellular models. It also seems to be, working well there. And that's something I bring up because it's very different, right? It's different than the gene therapy approaches. It's different than small molecule type approaches. And to me, as a basic researcher, that's what I like to focus on, is the things that are, potentially very new.
Yeah, it's really exciting. It's I think we talked about earlier that we just want to have lots of hands in lots of things. And I think we're so lucky in SCN8A that we have such an incredible diversity in researchers that are looking at different things. And I
agree.
Yeah.
And I don't want to give the impression that, peptide modulators are the only way to go. I think that it's, gene therapy makes a lot of sense. Small molecules can be delivered more easily than any of these other things. That should definitely be evaluated and should be pushed forward as well. I think you're right that having a nice, diversity of things where we're all working on different things that will give us the best chance, I think.
Yeah. Ron Mal, how about you? You published a paper this year, or last year, I should say 25, which was pretty exciting. And yeah, just tell us a little bit about your take on SCN8A research and what you're learning.
Sure, sure. Thanks for this opportunity. Yeah, and it makes sense for me to follow Chris. I think we do somewhat overlapping stuff. So I'm an assistant professor at UCLA. I am a clinician as well, but mostly I'm in the lab. And my clinical specialty is epilepsy, adult epilepsy, but I happen to see a lot of patients who have pretty severe DEEs. Not SCN8A in my current cohort, but SCN1A, 2A, CDKL5, et cetera. And so from a research perspective, my lab is really interested in brain development and using organoid models, which are these stem cell derived models where make like a 3D brain-like structure in a dish and try and understand what goes wrong in developmental diseases. And SCN8A is among those. And so this work that Gabby just described recently that we published was inspired by clinical, kind of one of our clinical observations, which is that a lot of patients that we have, they can come in and of course, the families here can attest to this, that seizures can be a problem, of course, and they may be the main concern, but sometimes it's something else, like their behavior, their memory problems, their learning disability, et cetera. And so we asked this question, how does SCN8A, if SCN8A affects different parts of the brain differently, like those parts that are important for seizures versus those parts that may be important for learning and memory? Could it have different impacts, which means we might have to have different treatments? And so using these 3D kind of models derived from patients in a dish, we looked at how a part of the brain that's important for learning and memory is affected by SCN8A versus a part of the brain that maybe has other functions. And essentially, we were surprised to see that the impacts are very different. And maybe most surprisingly, we think of SCN8A, at least I did, and perhaps I was ignorant to think this, that SCN8A is primarily this channel problem, that the channel is hyperactive or whatever. But what we learned is it seems that having this mutation in the channel seems to really affect how the cells develop and in different ways in different parts of the brain, which I think has implications for how we think about treatments. And in terms of things that I'm excited about, I think more broadly, it's not just SCN8A. We really want to kind of democratize this approach. So what we're really working on, partly in my lab, is developing these models. So mouse models are, of course, super useful. Human studies are critical. But these things, organoids, we think also have a really important place. But there's issues with variability, with how many organoids we can make, with batch-to-batch differences, which affect how we can really transform this technology into something that can be personalized for SCN8A or whatever other disease. So we're working on, not just us, but a bunch of labs are working on trying to kind of automate these processes, make every organoid similar to every other organoid we make so that it can be used for drug testing, for developing new therapies, for personalized medicine where we get stem cells from specific patients and can potentially even use that as a platform for testing drugs for that specific patient, et cetera. So yeah.
Yeah, very exciting. And it gets us a step closer. I mean, I feel like that's some revelations that are helping us think about how we can look at SCN8A differently and seizures and non-seizure challenges and how do we tackle those. So that's really, really important. Michael, do you want to?
Yeah, I was going to ask
Yeah.
a quick follow-up question to Ron Mal. It's so nice to meet you, Ron Mal.
Sure.
It's such important work, and it fits right on the roadmap. I don't know if you've seen our roadmap paper, but we want to loop you in for sure. And I'm sure Chris is probably excited by the things you're doing as well. My question is simple: is just that if we've looked at my daughter's mutation, we made a cell line, iPSC, from her cord blood, and we let the cells differentiate and influence them differentiate different type of neurons, and they don't make it too far before they start dying off. They don't get too mature, let's put it that way. I'm wondering in your organoids if you're seeing things develop, how the mutations are affecting cell development. Is it an organoid thing, or do you think it's really going in vivo? Could you make a parallel to what's going on in the brain as a child's developing?
Yeah, so that's a very challenging question to answer for obvious reasons because it's hard to check and we don't have fetal samples to check necessarily. I think my best answer to that is so we made cortical organoids and hippocampal organoids, for example, and we see clear differences. And so, for example, interneuron development in the cortex assembloid model, not just organoid, we're making assembloids, interneuron development was largely intact. So we didn't see deficits there, but we did in hippocampus, suggesting at least if the question is, is it organoid specific that you don't get proper development? There are certainly limitations of development in the organoid model for various reasons. But I think you can get differences at least, or so, right? Like if the interneuron problem was everywhere, then I would say, yeah, it's an organoid issue. But I don't think it's just an organoid issue. So I'm hopeful that these approaches could have relevance translationally. And adding to that, the idea that interneurons are important for hippocampal pathology, there's some data where interneuron transplant, for example, in epilepsies has some efficacy, which is hard to necessarily explain from a very granular perspective, but it's kind of consistent with our findings. And there's other data in the literature suggesting that this hippocampus issue isn't just in SCN8A, that's maybe a convergent issue with many developmental disorders, like early developmental disorders.
Would you say that your work is more on mechanism, or could there be a therapeutic outcome?
So I think the last part of what I was trying to, so I mean, I am, even though I'm a clinician, I'm sort of drawn to mechanism, but I think in terms of therapy, that's where I think we need to start thinking about making a lot of these. And for example, just doing drug testing, which we can't really do, right? And so if leading from your first question, are these models relevant to patients? Well, there's some data, for example, including in this paper that we published, where we recorded from intracranially from patients versus our hippocampal recordings, and we see some overlap, limited overlap in terms of some of the emergent properties, suggesting there's some similarities. And in terms of having a platform for drug testing, I think we really need to have sort of as automated as possible, is my biased opinion, but automated as possible, highly reproducible sort of a platform just to make lots and lots of organoids, maybe test therapeutics in scale. And in that way, at least that's one avenue where I think it's kind of therapeutically tractable. And we are working, and achieving that doesn't seem that it's that trivial. There's just little differences that seem to result in big differences in outcomes in terms of organoids, at least in our hands.
Well, thank you. We'll have you on the podcast, the Brian Pfister podcast.
I know, I was going to say, you guys are
all of you guys, but I know we got to hear from Josh too. So
yeah. Josh, tell us about the exciting stuff you've been working on. You've had several iterations of kind of really cool projects you're working on. So maybe just take us through a little bit of that.
Yeah, so this last year, I think it was best characterized as, if we're looking at the Hammer Lab research history as a play, it's sort of the end of an act where we're coming to a bit of a natural conclusion to our main focus. And so looking forward at what we want to do, I think that the best way of characterizing that is just expansion. So last year we published a paper on machine learning to optimize treatment recommendations for early in the clinical treatment process. Helped a lot with defining or expanding what the clinical consensus had already agreed upon for effective medications for gain of function, and removing and limiting the recommendations for some other medications. We also published an analysis of data held in citizen electronic medical records that helps define some of the more longitudinal and progressive features of SCN8A. And so we're at this point where we've kind of reached the limit of what we can do with what we've been doing. And so we're looking a lot at where we can go from here. And so, like I said, the word to describe it all is just expansion. We're currently working on expanding the genetic landscape. So this was a study that was partially done, or a part of what we're working on was done back in, I believe, 2019 by one of my predecessors in the Hammer Lab, looking at just where all of the variants in SCN8A are throughout the protein. And we're now redoing that with the near 480, almost 500 variants that we have collected through various reports, and then comparing that to distributions in SCN1A, 2A, 5A, 4A, 9A, and 11A. And so we're able to start expanding out into looking at these other similar channelopathies and seeing where SCN8A is similar and where it's different. We're also expanding what symptoms and phenotypes we're actually looking at. And so a lot of our focus since I've started working with Michael has been strictly on development and seizure profile. And now we're starting to incorporate more of the comorbidities because we have the data necessary to be able to make these correlations without there being so much extra noise. And then the other exciting project that we're starting to once again expand in is we're partnering with other rare disease advocacy groups such as SCN2A and CACNA1A for accessing their citizen electronic medical records. And so we'll be expanding our previous analysis pipeline to these diseases, and once again doing those inter-disease comparisons, seeing what SCN8A can learn from these other diseases and what these other diseases can learn from SCN8A. And then the final thing that's going on a bit more in the background is, again, expansion of the mechanistic classifications of variants. And so we're looking at incorporating biophysical properties more into our machine learning modeling. That's been a project working with Chris and Manoj Patel, trying to refine our various functional consequence predictors. And then also looking at the 480 to 500 SCN8A variants and running them through a variety of other machine learning tools to see if some of them are likely to cause splicing issues or other mechanisms of pathogenicity that aren't just a missense variant and shifting the amino acid.
Yeah.
Great summary, Josh.
Mm-hmm. Yeah, and there's so much ahead. I mean, we know that there are so many questions around functional testing and medication choice and care, paths. So it's really critical work that you all are doing. Well, you guys all have invitations to the yet to be started podcast, but if there's one thing that you're looking forward to most about in SCN8A research on the horizon, maybe give us a little taste of what you might cover. I'll start with you, Ron Mall. What's on the horizon?
Other than sort of what I mentioned already about kind of mass testing and generating protocols for organoid development, I guess I'm interested in this idea of convergence. It's also not SCN8A specific. There's some interesting papers that have come out about that. And I think this may be relevant to especially older patients, this idea that you have different variants causing different diseases, but there may be a few kind of critical junctures where things go wrong that can be pathways. So convergence meaning like SCN8A, 2A, 1A, whatever, that you have these specific pathways that are really important that may be targets of drugs. And so they could potentially help across different variants. And I think this idea is controversial a little bit, but it's, there's some nice papers suggesting, not from my lab, but from other labs suggesting that it is relevant.
Nice. Yeah, we'll be on the lookout for that, and we'll continue that conversation, I think. Josh, what do you see on the horizon?
Yeah, I'm interested to see, there's, at least from my point of view, been a increase in the trend where SCN8A seems to be putting itself in a position of leadership and pioneering research in the rare channelopathy space. So I'm currently working on wrapping up a review in machine learning of using SCN8A as a case study. I think the research roadmap from last year was an excellent addition to SCN8A as this, I guess, hallmark example of what a rare disease community, and both from the research and caregiver side and the complete community buy-in should look like from a rare disease perspective. And I think that a lot of the work with the citizen health EMRs and the registry has laid a foundation and laid out a map for other rare diseases to follow that I'm looking forward to exploring through the Hammer Lab. And I'm expecting other rare disease groups to start picking that up and following along once we get some more reviews and other papers published to wrap these up.
Yeah, they're going to be beating down your door, I'm sure. Chris, what are you looking at?
Well, I think one of the for me one of the most exciting things of these are these modulators of the channel, and we've shown that certain variants can be corrected, but we don't know how far we can take it. And if there are other variants that maybe are particularly amenable to this sort of correction, and maybe others that aren't, might we be able to go beyond just the channel properties and go to trafficking or their insertion into the membrane or the location in the cell? There's a lot of things that can be done once you're able to engineer the interaction of one thing that you can change with the channel, right? Then you can put it onto different parts of the channel. You can functionalize it. You can do all kinds of stuff there. Some of that's kind of interesting from a basic science standpoint, but I think the obvious first goal is to try to see if there's anything that can be done therapeutically with that approach.
Mm. Well, I think there's really exciting things ahead, and we're grateful that all of you are on this journey with us and helping discover new things and paving the path for better care and treatments based on increasing our knowledge about the disorder and how, and really understanding what's happening so we can better tackle it from lots of different angles. So thank you all for being here and all your great work. We will talk with you again soon.
Thank you.
Thank you.
Great
Thanks.
stuff.
Yeah. So I know we're running over. We're going to have just a couple more minutes. We're going to invite Julia Chase next up from Praxis to give us a little update on kind of what's happening from their point of view. As you all know, they have a clinical trial that has had some great results in SCN8A and SCN2A, and they are moving now to do a broader cross DEE trial. So, Julia, tell us a little bit about what you're excited about, what's happening.
Yeah, thank you for having us on today on behalf of Praxis. And for those who don't know me, Julia Chase, I am the Senior Patient Engagement and Recruitment Specialist at Praxis, and I work very closely with the advocacy groups. And again, thank you for having us today. It's really exciting time for the community and for us at Praxis. And I just want to highlight that relutrigine, or as many of you may know, the EMBOLD study, would not be where it is today without the community and those who helped participate in research. As Gabby just said, we recently completed our enrollment for the EMBOLD study for SCN8A and SCN2A patients early due to the efficacy we saw in our latest interim data analysis, which really enforced the confidence in relutrigine, and ultimately helped us inform our next steps with the agency, which we're really excited about. We still remain on track to submit an NDA, which is a new drug application, with the FDA in the coming weeks. And as we move forward toward regulatory review, our focus remains on advancing this program with urgency for patients and families. And we also are continuing with the EMERALD study, which is also trialing relutrigine in a broader DEE group. So we're excited to see how the outcome of that is as well. But yeah,
CNA families can enroll in that, right?
Yes.
So I mean, if you missed the first go round, Emerald or the different, oh, I'm always going to get them mixed up. But yes, you can still enroll.
Yes, Emerald is open for all DEs as well as SCN2A and SCN8A. And this one's actually a little bit different with the age group. So the EMBOLD study was 1 to 18. So Emerald is actually 2 to 65. So we really broadened that pool open. But
Amazing.
yeah, more
Yeah, I
updates
know.
to come.
It's really phenomenal to think about, a treatment being on the market specifically for a rare disease like ours that was only just discovered,
Yeah.
in 2012. I mean, it's quite a phenomenal path to treatment. Of course, we have to wait and see what FDA says, but it sounds pretty promising. But I think it's remarkable what a community can do when they are committed to data, to collaborating with industry. I mean, I know Michael and the registry have been a huge part of helping
Mhm.
pull together this work. I know that a lot of community leaders have helped in sharing, about the trial. I know in particular Aurora in Spain and the team from SCN8A Spain have done incredible work helping families who have relocated, helping to share the awareness. So it really is a community effort that helps move work like this along. And it's exciting to think what's on the horizon.
Absolutely.
Julia, so
Incredible.
we can see some of the exciting results on your webpage. Are there any updates you can give us as a thumbnail of what were the basic statistics, on what happened?
Absolutely. I have 2 slides that I can pull up. I didn't know if we were going to have enough time, but
I
let
don't know,
me
it's
just
up to
kind of
Gabby if we have
pull.
time.
Yeah, if you could just give a quick summary, that'd be great. I know we're already over. I'm bad. But
Yes,
yeah,
I
give
have
us
2 slides. I figured I'd keep it short, get the
Okay.
highlights, but here, let me know once you can see it in presentation mode.
Yep.
Okay, great. So we did a data cut in our first cohort, which was a smaller pool of patients. And within that cohort, we did a data cut at the 4-month mark, which was the end of the double-blind period, where we saw a 46% seizure reduction, which was right here. And then in our latest data cut, which was cohort 2, this was a broader pool of patients, we saw a decrease in 53% seizure reduction. And then all patients who were in the EMBOLD study for cohort 2 were taken, it was advised from the agency that all patients should now be on relutrigine. So those who were in the double blind were moved into our open label extension period, which means all patients were receiving drug and no placebo. And then continuing on, as patients continued with relutrigine at the 11-month mark, we saw a 90% seizure reduction in the in the open label extension period, which is incredible. So it's showing that the more you are exposed and on relutrigine, the better results you see. And then in addition to seizure reduction, we also looked at other domains and improvements. So we used the CGI scale and we looked at disruptive behavior, alertness, communication, and seizure severity intensity. And this chart compared to the first cohort was a massive increase, which was incredible for us to see. Namely, alertness was 78% by both the clinician and the caregiver reports, as well as a big increase in communication, and that's specific to the child, and then as well as seizure severity and intensity. So overall, we're really excited about not only the seizure reduction, but what we're also seeing in other improvements as well.
Yeah, it's phenomenal.
Wow.
We're so excited about where things are going, and yeah, it's just a monumental thing to have a treatment that's targeting our disorder. We know there's broader, applicability, but just grateful for all the work that you all are doing and looking forward to that NDA coming through and having a treatment at market.
Yeah, on behalf of the entire Praxis team, thank you all who have made this progress possible. And we're very honored to be on this journey with you all.
Yeah. Thanks so much, Julia. We'll talk to you again soon, I'm sure, as things progress.
Absolutely.
Bye.
Thank you.
Bye-bye.
Bye.
Amazing. So we're going to take one last segment. I'm going to invite Jayetta back on, and Julianne, Julianne Mills, one of our board members, to talk a little bit about where things are heading with the organization and how we want to invite you in to help us on that progress. So I'm going to pretty much hand it over to them to take us on this journey. And hopefully Jayetta is not too far behind. Let's see.
I have audio, but I can't activate my video. It's in your control.
Let me do that.
But without a video, I'll say,
here you go.
How start my video. Hi. What a fabulous overview of so much going on. We want to be very efficient here. We're welcoming Julianne, who's one of our newest board members, along with Brian, who you met, who's going to be the podcaster extraordinaire. But basically, we want to give you an overview of some of the challenges and opportunities that we're facing on our board, and let you know some of the needs and places where we need support to continue the work, As many of you know, the International SCN8A Alliance is part of a broader umbrella organization, Decoding Developmental Epilepsies, which actually includes not only the work we do in the Alliance, but across all DEEs and improving outcome measurement for DEEs. And it's wonderful to remind you of that, given the clear direction that we heard from all of the researchers, that there's so much opportunity for more and accelerated learning cutting across the DEEs. And then also from Julia, that both the Praxis and Neurocrine trials began in 8A, and then they went to 8A2A, and now they're going DEE wide. So there's a broader community that hopefully will, woohoo, I like that, a little sign. So Julianne, thank you so much for joining us. Tell us a little bit about your background, what brought you to us, so folks will have an idea of who you are and what you have brought to us.
Yeah, thanks for inviting me. It's a real delight to be here today with the community. So my background is as a scientist. I worked out at a hospital here in Philadelphia. Shout out to Maddie at the organization starting with genetic testing. This is pre-Human Genome Project. And then stayed with drug discovery through a couple of small and large biotech companies before moving into the CRO side, or clinical research organization side. And basically, for the last many years now, I've worked for companies that we don't do drug discovery ourselves, but we are the company that drug developers hire to run the clinical trials. So a company like Praxis would hire a company like ours, a CRO like ours, to run their clinical trial. And I've been supporting various rare disease clinical trials for about the last dozen years or so. And I came across this organization during my time at CCI. I had taken a step away from drug discovery for a little bit to work as a science consultant for the Rare as One program, which some of you may know about. And just through osmosis in that program, became aware of yourself, Jayetta, and Gabi. I'm a huge fangirl. And we've crossed paths multiple times, as I'm sure many in the rare disease community do. And then finally, there was an opportunity to contribute meaningfully. And so the way I really want to add value to this community is by combining what I do in my day job with what this community needs. And that is making trials more accessible for patients, for families and caregivers that participate. I saw some questions in the chat about, hey, I hope I get that trial in Turkey, or hey, I hope that trial comes to the Philippines. That's exactly what my job is to do, is to make sure that that's possible, make sure families can participate with as little friction as possible, as little cost as possible.
Terrific. There's so much synergy between our interests and the kinds of skills and experience you have. And in just, it's less than 2 months you've been with us. You've brought so much leadership and energy and real excitement about helping make our organization more effective, more sustainable, and in a position to really expand and continue the impacts we have. I wonder quickly if you could tell us what you see as some of the key challenges and opportunities of the DDE-wide board, and how you see, as chair of our governance committee and as vice chair of the board, really how to tackle and maximize the impact and effectiveness of the board.
I think the challenge that this board faces is not unique, and that is how to make the organization sustainable, right? How to make sure that as a board that we are providing the organization with the tools that they need to convert from a founder-led organization to a professionally led organization. I do want to disclose that I am not a caregiver for anybody with SCN8A or any DEE, but hopefully you've heard a little bit about my experience, and through my actions, I can demonstrate to you that there is still a way that I can add value. While I don't have that personal passion, I do have a passion for supporting patients and families living with rare diseases, in particular the DEEs, because of the large unmet need. And so I think the biggest challenge for our board is finding a way to convert from founder to professional and to make that sustainable. And that's really what I wanted to come on here today to do, was to talk a little bit about what we're looking for as we expand our board. Do you want me to share some slides?
Why don't you do that very
Sure.
quickly?
I'll see if I know how to. Do I know how to? Yes. Share. Slideshow.
It's coming.
There we go. Okay, so really excited to announce that the board is recruiting. And so if you've been listening this whole time wondering, what can I do? Let's talk about that. So there are several areas that we're looking for support on our board. I do want to highlight our priority right now is to find a treasurer. So anybody with finance and audit experience, we definitely want to hear from you. But other places we've identified are regulatory, scientific and clinical. I'm looking at you panelists from earlier. Anybody with experience in digital media, specifically like AI and cloud-based services, anybody with experience in fundraising, legal, public policy. You can see finance and audit is on here twice because it's really important we get somebody for that right now. But if you are somebody, or you know somebody who has some of these skills and might be interested in participating, we would love to hear from you. It doesn't have to be a now thing. It can be a future thing. If you're worried about how much time you have to commit, let's talk. There is more information you can find on the website. We're always here to receive emails. So, this is not a one-time offer. We will be recruiting for many months to come. So if you are somebody, again, that's got any interest or skills, or somebody, grandparent, aunt, uncle, who might have some skills in this area, please do let us know. Anything you want to add, Jayetta?
No, Julianne, that was fantastic. In the interest of time, we're already a half hour. I'm going to turn to Gabi, if you would come back on, because we also have another area where we're recruiting, and this is an area where every one of you as caregivers, parents in 8A, we really need your support. We need your engagement. And Gabi, tell us a little bit about the other opportunity we're recruiting for right now.
Yeah, so this has been kind of in the works for a while, and we're really excited to launch this effort to build an SCN8A caregiver advisory group, which is essentially going to be a group of caregivers that will help us to determine how we move forward strategically with our work at the Alliance. We are a caregiver centered organization started by two parents and a grandmother. So we believe very strongly in keeping everything very focused on caregiver goals and needs. So this is a council that will come together to work and help us prioritize and consider how we move forward with different activities. And will really help guide the programming team, which is me and Kalie and my team at the Alliance doing the work, and the board to think about how we really continue to push forward for a better future for SCN8A and push the science and contribute to ensuring that we can keep things moving. And Kalie put in the chat, there's a link if you want to see a little bit more about what we're recruiting for and how you can put in an application. This is going to be coming together over the next few months, and we welcome a diverse group of families with different experiences. And, you don't need any, special skills to join that, just a desire to want to move forward the work for SCN8A and for our families. And that is your expertise, is as an SCN8A caregiver, as someone who lives this and breathes this and sees what we really need as a community. So we're really excited to build that out and hope to hear from more of you. We'll share more information on that as well. But yeah. So
I think we can wrap that up. It's clearly, as you launched at the beginning, it's been an exciting year, and there's just an exciting decade ahead. And that's what our vision is, to really move aggressively to build on all the capacity, all of the extensive networks that we have of clinicians, of researchers, of families and industry partners to really catapult us to more effective disease-modifying treatments that really improve our kids' lives and outcomes.
Yeah. And so here we are, the three co-founders again, to take us out and just to thank you all for being with us today. If you're watching the recording, you are the reason we are doing this work. Families are what drive us every single day. I personally live this life with all of you. It's challenges, it's ups, it's downs, it's really marking and getting inspiration from every smile that we get, every small achievement that comes for our children who work so incredibly hard. All of these families who are just become incredible advocates for their children and their community, and we're so grateful to all of you. There's so many exciting things ahead. Michael is leading a lot of exciting efforts at the Alliance to really move the science forward. And I think we are in a most exciting place. I think ever since I've been around, my son is 13 and we've had a diagnosis since he was a little over 1. So I think I can safely say that there are more exciting things on the horizon right now than there ever have been before, and more promise for our children and future generations. I don't know if, Michael, you want to add, have the last word, take us out? Oh, you're muted.
Thank everyone for coming. Thank you, Jayada and Gabi, for putting this wonderful session together. And I look forward to seeing all of you in our network meetings and one-on-one meetings. And I wish you all the best of health in the near coming future.
Thank you, everybody. Take care. We'll see you again soon.
Be well, everybody.
Bye.
Look forward to seeing you. Spain's still up. Whoa.